You wake up with a regular headache. Nothing dramatic, just that dull pressure behind your eyes. Maybe a little fever, maybe a small cut on your finger from yesterday. So you do what everyone does. You open the medicine cabinet, grab a pill, drink some water, and move on with your day. Easy. Now, take that same headache back 50,000 years. Same body, same pain, but no doctor, no antibiotics, no pharmacy around the corner. Not even the idea that tiny invisible things could get into a wound and make the whole body sick. A small cut on your finger could mean you couldn't hunt for weeks. And then the people around you had to make a choice. Do we keep feeding this person? Do we keep watching over them? Do we carry someone who can't carry themselves? And somehow, again and again, humans chose to help. So the real question isn't just how we survived, it's why we kept saving each other. For most of human history, getting sick meant entering a mystery with no instruction manual. Your body gave you clues: pain, heat, shaking hands, a wound turning red, a child who suddenly stopped eating. But nobody really knew what those clues meant. No microscope, no germ theory, no hospital chart explaining what was happening under the skin. A broken bone could change the rest of your life. A parasite could slowly drain your strength. Childbirth could put both the parent and the baby in danger. A fever wasn't just a fever, it was the body sending a signal, and people had to learn what that signal meant by watching closely, by remembering, by hoping they were right. And humans had one thing no pill bottle can replace. They had each other. They watched. They remembered, they taught, they stayed. They didn't have laboratories, but they had generations. They didn't have doctors, but they had someone who refused to walk away when another body started failing. And one of the oldest clues comes from a place called Shanidar Cave, because there, the evidence may not be a tool or a plant. It may be one disabled Neanderthal who should have died, but didn't. One of the clearest clues comes from the bones. At Shanidar Cave in northern Iraq, researchers found Neanderthal remains that tell a very human story. One individual had lived with serious injuries and disabilities that should have made survival almost impossible. A damaged body, limited movement, no real chance of hunting, no easy way to gather food. In that world, every meal took effort. Every day asked something from the body. So if you looked at it coldly, that person might have seemed like a burden. But that's not what happened. Someone brought food. Someone kept them warm. Someone cleaned the wound when it got bad. Someone stayed close when they couldn't protect themselves. That matters, because this is where medicine really begins. Not with a white coat, not with a pill, not with a hospital, but with a simple decision from a group of people. This person is still worth helping. Before there were hospitals, there was someone sitting near the fire, making sure the sick weren't alone. But care could only go so far, because the body doesn't just need comfort. Sometimes it needs something that can help from the inside. Animals were the first witnesses. A sick chimp will chew a bitter plant it normally avoids. A dog will lick a wound. Some animals seek out leaves, bark, or clay when something inside them feels wrong. Humans saw that. Then they did what humans do best. They remembered. One leaf seemed to calm pain. One strip of bark brought a fever down. A strange mushroom helped with parasites. Honey kept a wound from turning foul. Garlic did something to infections, long before anyone knew what bacteria were. And we have real clues for this. Ötzi the Iceman, a 5,300-year-old mummy found in the Alps, was carrying birch polypore mushrooms when he died. That may sound random until you learn those mushrooms have properties linked to parasites and inflammation. In other words, he may have been carrying medicine. Then there's willow bark. People used it for pain and fever for thousands of years. Inside willow bark is salicin. Your body turns that into something that helps with pain. Much later, modern chemistry stabilized a version of it and gave it a name you know: aspirin. But this wasn't magic, and it wasn't some cold experiment. Think about what that actually meant. Someone was sick, someone was hurting, and another person reached for a plant because they had seen it help before. Sometimes it worked, sometimes it didn't, and sometimes the person trying to help may have watched someone they loved get worse. That is the part we forget. These were not scientists in white rooms testing samples. These were people trying to save a child, a parent, a hunting partner, a friend. They didn't know the names of the chemicals. They didn't know the mechanism. They only knew this. Sometimes the person who took it made it through the night. So one of the great symbols of modern medicine began with someone desperate enough to chew tree bark, and someone else caring enough to remember that it helped. But leaves, roots, mushrooms, honey, they all had a limit. When the body was damaged too badly, ancient humans faced a much harder choice. A person is lying on the ground with a leg so badly damaged that everyone around them understands the truth. If they do nothing, infection might win. No antibiotics, no clean hospital bed, no anesthesia that gently turns the world off. Just stone tools, fire, hands, and people who don't want to lose someone, cut it off, or watch them die. And the extraordinary part is, some of them survived. In Borneo, researchers found evidence of a surgical amputation from around 31,000 years ago. The bone had healed afterward, which means the person didn't just survive the cut. They survived the bleeding, the shock, the infection risk, and the long recovery after. But don't picture that like a clean scene in a hospital. Picture someone having to make that decision with shaking hands. Maybe it was someone they had eaten with, someone they had walked beside, someone whose voice they knew. And they did it not because they were cruel. They did it because it may have been the only way to keep that person alive. That changes the story, because this wasn't just panic, it was skill, and it was care under pressure. Then there are the skulls. All over the world, ancient skulls have been found with holes cut into them, not smashed in battle, cut, shaped, worked by human hands. The procedure is called trepanation, and some of those skulls show bone regrowth around the opening. That means the patient lived long enough for the body to repair the edges. Someone stayed with them after. Someone kept the wound clean. Someone brought water. Someone waited to see if they would wake up. Broken bones were set and supported. Wounds from hunts and fights were cleaned. Arrowheads, splinters, and shattered bone had to be dealt with by someone who knew the difference between helping and making it worse. The question isn't just how they had the nerve to do it. The question is how much they must have cared to try. Every healed bone is proof that someone survived, but also proof that someone else stayed long enough to help them heal. And behind those decisions, there was usually one person holding the most dangerous knowledge in the group. That person had many names: shaman, healer, midwife, herbalist, bone setter. But the title isn't the important part. The important part is what they carried. They were the person who kept the group's knowledge inside their head. Which leaf was safe? Which root was poison? Which fever might pass by morning? Which fever meant people needed to get quiet? They knew how to help bring a baby into the world, how to wrap a broken limb, how to clean a wound before it turned bad. Were their explanations always right? No. They might have blamed spirits, curses, balance, energy, anything that helped them make sense of a body falling apart. But if honey kept a wound cleaner, they remembered. If one plant brought the heat down, they saved it. If one method helped a child breathe through the night, they taught it. In a world with no medical books, one old person who remembered which leaves saved children was worth more than gold. Because they weren't just carrying remedies, they were carrying memories. Who survived? Who didn't? What was tried when everyone was scared? And if that person died without passing it on, the group didn't just lose a healer, they lost part of their survival. The theory could be wrong, but the result could still be right. And in the ancient world, that was enough to keep someone alive one more day. But we should be honest about this. Ancient medicine helped. It mattered. It saved people. But it didn't save everyone. A small wound could still go bad. A baby born in winter might not make it to spring. A parent giving birth could be in real danger. A fever, an infected cut, a bad tooth, dirty water, parasites. These were ordinary problems with serious consequences. And when someone got too sick to walk, hunt, gather, or eat on their own, survival became something shared. Food had to be brought. The fire had to stay alive. Someone had to sit close enough to hear if the breathing changed. That's the part worth paying attention to. Humans didn't make it because they were invincible. They made it because someone remembered which plant had helped before. Someone knew how to wrap a broken limb. Someone kept water close. Someone stayed awake through the coldest part of the night. Someone refused to leave a sick person alone. That was the difference. Not magic, not luck. Care, memory, observation, and people willing to try again. Medicine didn't begin when humans invented pills. It began when one person saw another person hurting and decided, I'm going to help. The pill in your hand is not the beginning of the story, it's the last page of a very old case file. Aspirin, antiseptics, antibiotics, surgery, hospitals, all of it sits at the end of a chain that started long before anyone had the words to explain it. Someone chewed bark and noticed the fever dropped. Someone packed honey into a wound and saw it heal cleaner. Someone watched a healer prepare the same remedy their teacher had learned from someone even older. And somewhere, a parent made it through one more night because another person stayed beside them, kept them warm, and refused to leave. Every tablet you swallow today stands on thousands of years of pain, failure, memory, and care. We didn't create medicine from nothing. We inherited it from people who had to learn the hardest way possible. If this made you look at the medicine in your house a little differently, leave a comment. What ancient medical discovery shocked you the most? The tree bark that became aspirin? The skull surgeries? The honey packed into wounds? Or the simple fact that care itself may have been humanity's first medicine? And if you want the next case file, tell me what to open next. How humans first understood death, how ancient people treated the mind, or how surgery began before hospitals, before steel, before anyone truly understood what was happening inside the body. Because this story doesn't end with one pill. It goes much deeper.